Haleigh. I'm going to be your nurse practitioner today.
Hello.
Hi. I'm going to start with the head to toe assessment if that's all right. I'll first start with your hands. Hands are nice and symmetrical, warm to the touch, no lumps or bumps. Capillary refill, less than 3 seconds, and all fingers. Okay, now I'm going to go to your head. I'll first start with having you smile, and then puff your cheeks out. Cranial nerve 7, facial nerve intact. I'm going to palpate your head. Tell me if you have any tenderness. Hair is nice and clean, no lumps, bumps, or abnormalities. I'm going to go to your face. I'm feeling your temporalis and masseter muscles. Go ahead and clench your jaw. Okay, relax and clench and relax. That's testing for cranial nerve 5, trigeminal motor aspect intact. Now I'm going to have you open and close, open and close. That's checking for TMJ. You have checks for cracks and pops, which you had none present, which is great. Now I'm going to check your sinuses. I'll start with your frontal. Tell me if you have any tenderness. And your masseter. All right, great. So next I'm going to move on to your eyes. Eyes are nice or symmetrical. There's no drainage present. I'm going to first start with a couple of different tests. I'm going to have you cover your right eye. And I'll cover with you. And you'll tell me when you can see my finger coming in.
Okay. Okay. Okay.
Okay, and your other one. And I'll have you look right at me.
Okay. Okay. Okay.
All right, so that checks for optic nerve 2 and it's intact. Next, I'm going to do a couple more vision tests on you. I'm going to have my light. Just look straight at me. Checking for your corneal light reflex. Okay. And then I'm going to have you look at me, but you just move your eyes with my fingers, checking for cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. They are all intact. Good job. Okay, so now I'm going to look at the external features of your eyes. I'm going to have you raise your eyebrows and relax. Eyebrows, eyelids, and eyelashes are all within normal limits. I'm going to look at your internal eye. Cornea, conjunctiva, and sclera, all within normal limits. Iris is blue. Your pupils are nice and symmetrical, equal bilaterally. Check your pupils real quick to light. And follow my finger all the way in. Pupils react to light and accommodation. Great. Okay, so now I'm going to look inside your eye. Just look straight ahead. I can see the red light, ocular fundus, disc, vessels, macula, and your retinal background. Great. Alrighty, so that will conclude our eyes. Okay. Next, I'm going to go on to your ears. I'll first inspect them. Ears are nice and symmetrical with your eye height. Great alignment. Tell me if you have any tenderness. And feel your auricles and your tragus. They're warm to the touch, no lumps or bumps. I'm going to perform a couple different tests on you. I'm going to go behind you. I'll have you start by covering your left ear. And then I'm going to whisper and you tell me what you hear. ABC.
ABC.
Yep, and now I'll have you cover your other ear.
1, 2, 3.
Yes, good job. That was checking for cranial nerve 8, acoustic, intact. Now I'm going to perform 2 different tests on you, the Weber and the Rhine test. I'll first start with the Weber. It'll go on top of your head and you'll tell me if you hear it more in the left, right, or if it's equal.
Equal.
Great, so that would be a normal finding. It checks for hearing loss, which you had none. Next, I'm going to do the Rhine test. I'm going to put it on your bone. You'll just say now when you can no longer hear it. And then in front of your ear and say now when you can no longer hear it.
Now. Now.
Okay, and that will be a normal finding because air conduction was greater than bone conduction. We'll do your other ear.
Now. Now.
Great. Okay, so next I'm going to look inside your ear. I'll do your left ear. auditory canal is nice and clean. Tympanic membrane is pearly gray. I can see the cone of light at 7 o'clock. All landmarks are present. Malleus. Great. No earwax present. Alrighty. Okay, so next, now we'll conclude our ears. I'm gonna go onto your nose. Nose is nice and symmetrical. Warm to the touch, no lumps or bumps present. I'm gonna check for patency. I'm gonna have you hold your right nostril and sniff. And then on the other side. All right, patency is equal. So I'm gonna change my tip, and next I'm gonna look up your nose. Okay. Septum is midline, turbinates, nasal mucosa is nice and pink. Good. Alrighty. So that's it for the nose. Now we're gonna go to your mouth. Get my light. I'll inspect your mouth with my light. Just have it open up wide. Okay, hard and soft palate and gums, nice and pink. Buccal mucosa is nice and pink. Teeth, nice and white, all intact, no decay. Have you stick your tongue out, move it side to side, up and down. Tongue is pink and moist, and that was checking for cranial nerve 12, hypoglossal intact. I'm gonna have you kind of stick it out so I can see your tonsils real good. Real good, tonsils are about a +1. I'm gonna have you say ah. All right, and I was checking your uvula. It had great mobility. It constricted up and stayed midline. And that was checking for cranial nerve 9. Glossopharyngeal. And I would also check for cranial nerve 10 at this time, vagus, with the gag reflex, but we're not doing that in this video. So next, that will conclude your mouth. I'm gonna go to your neck. Neck is nice and symmetrical, warm to the touch, no lumps or bumps present. I'm gonna go ahead and feel all your sinuses, so if you have any pressure or pain, let me know.
Okay.
We'll start with occipital, postauricular, preauricular, submental, submandibular, tonsillar, superior cervical. I'm going to turn your head that way and feel your deep cervical chain. Okay, and the other way. Okay, now look straight. Posterior cervical. I'm going to have you kind of shrug up a little. Feel your supraclavicular, your infraclavicular. Okay, and relax. Now I'm going to go under and feel your axillary. And your epitrochlear under your elbow. And your other arm. Axillary. And your epitrochlear again. Alright, so no lymph nodes were palpable, which is great. Now I'm going to feel your trachea. Trachea is nice and midline, no masses present. And feel your carotids one at a time. And I'm going to listen with my bell. There were no bruises present. Next, I'm going to do some range of motion on your neck. I'm going to have you look left, right, up, down, and then shrug your shoulders. And I'm going to do a little bit of a, see how your muscle strength is. I'll have you look left and push against me, and right. Okay, and then push against me. Good. So I was checking for cranial nerve 11, spinal accessory, and it was intact. All right. So I'm going to go behind your neck, check your thyroid. I'm going to have you swallow and swallow again. All right, thyroid was palpable, no masses present. Okay, so that will conclude our neck. Next, I'm going to have you kind of turn around and look at your back. Oh, sorry. All right. So you tell me if you have any tenderness. Skin is warm to the touch. No lumps or bumps present. Take a deep breath in and out. And one more. Great. Expansion, equal and bilateral. Respirations are within normal limits. I'm going to move my hands on. I'm going to keep saying 99.
99, 99, 99, 99, 99.
All right. checking for tactile firmness. Now I'm going to start percussing all 8 lung fields. All right, great. Now I'm going to check for CDA tenderness. Tell me if this is tender at all. All right, now I'm going to palpate your spine, spinal accessory. Check for any masses. There were none felt. Spine is midline. Okay, so now I'm going to go on to auscultating. I'll just have you take a deep breath in and out every time you feel my stethoscope move. If you get short of breath or dizzy, just let me know. We can stop and listen with my diaphragm. And one more. Great. So now I'm going to repeat that, but every time you feel my stethoscope move, just say 99 again. Check for egonophy.
99, 99, 99, 99, 99, 99, 99, 99.
Great. And now I'm going to repeat that, and I'll just have you say E. Oh, excuse me. Sorry, I'm probably young. This is egonophy. That last one was bronchophony.
E, 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 E.
Great. And now I'm going to have you do one last one. I'm going to have you whisper 1, 2, 3 every time you feel it move. Great, so lung sounds were clear, equal, and bilateral throughout all lung fields. I'll have you turn around now, and I'm going to assess your front of your chest. I'll have you sit up first. Oh, just to listen, and then we'll have you lay.
Okay.
Okay, so first I'm going to start again by palpating. Tell me if you have any tenderness. Okay. Next, I'm going to percuss all 8 lung fields again. Alrighty, I'm going to repeat the 99.
99, 99, 99, 99, 99.
Alright, that's checking for tactile firmness. And then this time I'm just going to do all 8 with deep breath in and out on the front. With my diaphragm. Okay. Breath sounds clear, equal, and bilateral all throughout. Okay, so now actually I'm going to have you just kind of lightly bend over and just listen to your aortic and pulmonic and check for murmurs. No murmurs heard, so that was great. So before I have you lay down to your heart and do a little range of motion on your arms.
Okay.
First I'll assess. Arms are nice and symmetrical, warm to the touch. I'm going to check your brachial pulses and your radial pulses. Pulses are great, 2+. Okay, so I'm going to have you move your hands up and down, and then put your arms down, do your elbows, good job, and then straight out and behind your head, check for your shoulders, good job. Okay, so now I'll do a little muscle action with it. So put your arms out and push up against me. Okay, now down. Okay, then put your arms up like this and pull and push. All right, great. So that was equal and bilateral in both upper extremities. I'll have you lay down now and we'll get to your heart. All righty. Make sure you can see good. Okay, so first I'm gonna start by inspecting and palpating your precordium. Tell me if you have any tenderness. Skin is nice and warm to the touch. There's no heaves or pulsations present. I'm going to check for your apical impulse just by palpating at the 5th intercostal space midclavicular line. Alrighty, no pull. Awesome, no thrills. Okay, actually while we're here, I'm going to go ahead and count your apical pulse and rate. Once again at the 5th intercostal space midclavicular line. Heart rate is about 76. Okay, so now I'm going to go ahead and listen to all of your heart sounds. We'll start with the aortic at the 2nd intercostal space, right sternal border, and this is with the diaphragm. And then the bell. And then we'll go to the pulmonic, 2nd intercostal space, left sternal border with the diaphragm. And then with the bell. Okay, now we'll go to Erb's point, 3rd intercostal space, left sternal border with the diaphragm. And with the bell. Go to tricuspid, 4th intercostal space, left sternal border with the diaphragm. And with the bell. And the mitral, 5th intercostal space, midclavicular line with the diaphragm. And with the bell. Okay, S1A and S2 was heard. There was no murmurs, rubs, or gallops present, so that's great. So that will conclude our heart. Next, I'm going to go to your belly. I'm actually going to walk around to the other side. So first, I would start by inspecting. Belly's nice and flat. There's no lumps or bumps. Warm to the touch. And then next, I'm actually going to go straight to listening. Try to get your bowels all moving here. No pulsations present. I'm going to listen to all 4 quadrants. Bowel sounds are nice and active. Next, I'm going to listen to all of your arteries. We'll start with your aorta. And your renal arteries. Your iliac arteries. And your femoral arteries. Sorry, I'm probably yelling. Okay. Umbilicus is midline. Next, I'm going to go to percussing. I'm going to percuss all 4 quadrants. This is to check for dullness, tympany, and resonance. I'm going to palpate your, percuss your spleen. And your liver. And while I do this, I'm actually going to measure. So this will be at the right midclavicular line. Move up first. Okay, and then we'll make our way down. And we will measure in centimeters. Right on the dot. 6.5 to 7 centimeters, so that's great. 7 centimeters is normal and average for women. Okay, so next I'm going to palpate. I'll start with light palpation in all 4 quadrants. Tell me if you have any pain or tenderness. Now deep palpation. And we will palpate your liver. I'll take a deep breath in. And liver was non-palpable. And now same for the spleen. Take a deep breath in. And the spleen was non-palpable as well. Now breathe. I'm going to palpate your aorta. And your kidneys. So also have you take a deep breath in again. All right, and breathe, and we'll do this one. All right, great. Pull your shirt down. I'll have you stay lying though. I'm going to go to your legs next. So legs are nice and symmetrical, equal and bilaterally. Warm to the touch. There's no edema present. I'm going to feel all of your pulses. I'll start with your popliteal. Great. Posterior tibial. Great. And your dorsalis pedis. Great. Okay, now we'll do a little range of motion with your legs. I'll have you lift leg up one at a time. Just straight up. Great. And your other one. And I'll have you repeat that, but bring your knee in each time. All right. And then I'll have you move your feet up and down with your ankles, roll them in circles, and now do the same kind of with your toes. Great. Alrighty, now I'm going to have you sit back on the side of the table if that's all right. Okay, so now I'm going to do a neurological exam on you. I will first start by, I'm actually going to pull the table back so we can get your feet and everything. See your feet? Yes, good. Okay, that will be good. Okay, so first I'm actually going to start. I'm going to have you close your eyes and just say now when you feel something.
Now.
Ophthalmic branch intact.
Now. Now.
Maxillary branch intact.
Now. Now.
And mandibular branch intact. Okay, you can open your eyes. So that was checking for trigeminal nerve 5 again. The cranial nerve, the sensory aspect of it. So it is intact. Okay, now I'm going to have you close your eyes. I'm going to check for light and pain sensories in your arms, hands, feet, and legs. Start with your arms. Tell me if it's dull or sharp.
Sharp. Sharp. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, and your legs.
Sharp. Dull. Sharp. Dull. Sharp.
All right, great. Okay, so you can open your eyes now. I'm going to do 2 more tests on you. One is called stereogenesis, and I'm going to place objects in your hands, and you tell me what they are. So go ahead and close them now. Place one in your right hand, and close and tell me what it is.
Key.
Yep, and in your left hand.
Paperclip.
Yes, great. Okay, now keep your eyes closed. I'm going to have you tell me, this is called position sensitive. I'm moving your finger up or down.
Up.
Sorry, I'm going to lift your hand in here.
Down.
Okay, and then same for your toes.
Up. Down.
Great. Okay, you can open your eyes now. Now I'm going to check cerebellar function. I'll first start with your hands, upper extremities. It's called rapid alternating movements. I'll have you fast up and down. Great. And then I'll have you do heel to shin. Take your heel and move it up. Yep, and then to the other. Great. Okay, now I'm going to do deep tendon reflexes here. We'll start with your arms. Your bicep, I'll go on the internal. Okay, and relax. I'm going to get your tricep. Okay, and brachioradialis. Oh, that was a good one. Okay, and bicep again, relax. Okay, and tricep. And back to brachioradialis. Okay, and your patellar. Now relax. That's kind of hard. Okay, and your Achilles tendon. Your other. All right, and this is Babinski's reflex. Check on the bottom of your feet. All right, great. So this next portion, I'm actually going to have you stand. I'm going to have you walk down on your heels and back on your toes. Okay, and back on your toes. Oops, sorry. Okay, great. Now I'm gonna have you face this way. I'm gonna have you close your eyes and put your feet together. This is called the Romberg's test. All right, great job. Now I'm gonna have you open your eyes. So now I'm going to check your spine. I'm gonna have you turn around, slightly bend your knees and then bend over. And I'm gonna palpate your spine, checking for scoliosis, lordosis, kyphosis. This is great. Your spine is midline. None of those are present. Okay, then stand back up and I'll have you face the camera again. I'm gonna check more range of motion in your spine. I'll have you hyper reflex back. Yep, and then bend down side to side. And then rotate, like turn to each side. Great. So your range of motion is great in your spine. Well, that concludes our exam. Do you have any other questions for me at this time?
No.
Okay, thank you.